Hi, my name is Ashley Cook, and I chose the virus known as Ebola, also called the Ortho-Ebola Zarians virus. Um, I've always been fascinated by highly virulent deadly diseases, so that is why I chose this one. Here are the sections that I've covered about Ebola: the diagnosis, the symptoms, treatment, prevention, and what happens after Ebola. Ebola was first discovered by Dr. John Jacques Muyembe um, and Dr. Peter Piot. It was discovered in the sub-Saharan African region, and it was named for the river where it was found, which is the Ebola River, and it was found at what was then known as Zaire. It was actually found in a uh, nun who had came down with a disease, and he flew her to another country that had the ability to test for the virus, and so that's the little nod to the flying nun. So here about the virus: the pathogen is the Zaire Ebola virus or the Ortho Ebola virus variants. Those are used interchangeably. The genus is the Ortho Ebola virus, and then the family is the Filoviridae, which means thread-like. This is a schematic representation of the genome, and also gives you a linear view of the glycoprotein. The Ebola virus is a single-stranded RNA that is comprised of several encoding protein genes that you can see here in the diagram. There have been approximately 15,409 people as of 2022 that had died, but now there was another outbreak in 2025, and an additional 45 people succumbed during that. Here you can see that the largest outbreak of the Ebola virus was during 2014, and there was a whole lot of hysteria in the United States about the virus at that point. One being this one, and I kind of made this parody here of what Trump would have said had it been videoed at the time.
Donald Trump is calling for a complete and total shutdown of Ebola virus disease entering the United States of America.
Here are some of the tweets and things, and Rand Paul and a lot of politicians and famous people at that time were very outspoken about the virus and were really concerned, and it became kind of a hysteria thing. So now a little bit about diagnosis and transmission of the disease. The way that it is diagnosed, there's two tests you can use. One is like a rapid test, antigen type test that you would do for COVID now, and then there's also the PCR test, which is the most sensitive. It detects genetic materials from the virus, and it also will be able to detect the virus much earlier. Symptoms mimic a whole lot of other things like flu, malaria, colds, just all of the typical things, so it does make it somewhat difficult to diagnose in the early stages. There are two phases of Ebola, considered the dry and the wet phase. The dry phase is a fever, headache, muscles and joint pain, fatigue, red eyes, sore throat, and then the wet phase starts, which includes diarrhea, vomiting, and people can lose as much as 10 liters of fluid a day. So this is a very, very um, deadly disease just based on volume loss alone. One of the weird symptoms that Ebola causes is hiccups, and that is something that is usually only found in a more severe case of the disease. The late stage symptoms can include bleeding from various orifices of the body, and then if you've had like blood draws or IVs, those can start oozing. There'll be petechia, which is bruising under the skin, people can experience seizures, bloody diarrhea, vomiting of blood, just a whole host of horrific areas that you don't really want blood to be coming from. Um, Early treatments were pretty much not a lot, just some supportive care. People were kind of nursed back to health and hope for the best, and the death rate was about 90%. Now there are a few more options available. The first iteration of that was ZMAP, who Dr. Ken Brantley, who was one of the Samaritan's Purse physicians that was overseas volunteering during the outbreak, received. He and a colleague, and they ended up both surviving. That treatment ended up being somewhat successful for most of the people that were given it. But now we have a vaccine, which is very important because it is 84% effective in the real world and was about 100, like 99.9% effective in the lab setting. Monoclonal antibodies are another treatment that are available, but they are not nearly as successful. Um, they only reduced the death rate to about 34%, and we were at 50 to 60 just with supportive care and not using ZMAP with the last one. So again, they do have some efficacy, but they're not significant. Supportive care is very important with O2, rehydration, vasopressors to bring people's blood pressure back up, and things like that. So again, there's several treatment modalities available now, which has been and will likely continue to bring the death tolls down if people can get access to the care. Unfortunately, some of the areas are very remote and poor and don't have the facilities to contain the medicine and everything that they need to, and they unfortunately end up having high death rates. The way to prevent it is the vaccine. They're using the ring vaccination technique. Once they find and identify an outbreak, they start vaccinating people that have had contact with people or the healthcare workers in the area, etc. That has been successful, but again, it is in the early stages, so I assume we will see that continue to improve with time. The way to prevent Ebola is avoid contact with infected persons and any clothing and things like that. Don't eat bushmeat. That is one of the host and reservoirs, bats and non-human primates. Unfortunately, a lot of people, the outbreaks have started that way. Vaccination is the best chance of surviving Ebola or dealing with the outbreaks once it happens. The main thing is that people seek care immediately, and then they, with a lower viral load, once they start a treatment, they have a better chance of surviving. Rigorous hand hygiene is also important to use. And again, avoiding contact with bedding and any sort of bodily fluid soaked things that people had contact with. So now, if you survived Ebola, what does that mean? A little bit like COVID, there are some long term effects that Ebola has, and people can continue to have symptoms for a long time, as much as 4 years after they were infected with Ebola. One of the interesting and special considerations are regarding seminal fluid that can be infected for as much as a year. Or over a year. There was a lady that was contracted Ebola after she had sexual intercourse unprotected with a man that had recovered from Ebola more than 200 days previously. And then it can also live in the eye area. So eyes and seminal fluid are places that it can kind of harbor itself for a long time and still infect people. Almost 75% of people that had Ebola have long-term complications. It's a bit like long COVID. So that's a quick overview of the Ebola virus.